La Crosse County had 23 drug overdose-related deaths in 2016, which is the most in its history. That's why nurses with the La Crosse County Health Department are addressing a lack of access to treatment options and recovery services in our area for those who are addicted to drugs. News 8's Sarah Tamer has more on why nurses say it's time to focus on long-term recovery options.
It's a nationwide issue.
This is an epidemic that's hitting all of the Midwest right now.
And we're seeing more of it in La Crosse.
We're seeing an increase in admissions to the hospital for drug-related overdoses and intoxications.
Last year, doctors at Gunderson Health System saw nearly 1,600 patients with drug-related overdoses.
This is a huge burden on the community and the health system.
Doctors say nearly half of those patients end up staying in the hospital.
These are the numbers that we need to get to figure out how we can start making a difference.
La Crosse County Public Health Nurse Joe Larson says it's important to think of the long-term recovery options for people who have received treatment in the past.
They're never going to be able to get back and succeed if they're going back to the same situation that they left. So whether that's going back to families that are using or other stressful situations, the same social circles.
Larson says there are a few factors contributing to substance abuse in our area, some of which are untreated mental illnesses and limited treatment options.
What we really need is safe areas, safe housing, safe support systems, and that's really lacking in La Crosse.
However, doctors at Gunderson say hospitals have an important role in bridging the gap between drug abuse and long-term treatment. With
the data that we're getting, we're going to be able to focus on certain areas of the community that need certain prevention aspects, and I think that's really the key, because there's only a limited amount of money for projects like this, for treatment, and in prevention, if you can focus them on the areas they really need, you can be more effective.
Reporting in La Crosse, Sarah Tamer, News 8.
Doctors also say they hope to bridge the gap by increasing community support and education. They're also hoping to receive more funding to help with treatment and prevention.